I would like to welcome you in Canon Medical booth. We are here at ARM, and welcome to our booth. As Canon Medical, of course, I don't know if you know that, we have full range of modalities from CT scan to MRI to cath lab to ultrasound. We are taking care of imaging in the radiology world. Our topic is AI, artificial intelligence. We were from the beginners who have the artificial intelligence. We were sponsor of artificial intelligence, or we consider ourselves at least sponsor of artificial intelligence in the imaging world. Our solutions is within the modality. Our AI is within the modality. So we embedded the artificial intelligence inside of CT scan to have the CT scan 4 times faster. In MRI, we all know that the problem of MRI is time. There is a lot of claustrophobic persons. I don't want to have an open MRI because the resolution will not be good. So we embedded the artificial intelligence inside MRI to have faster, better resolution, and better image. In our ultrasound and cath lab as well, the quality of image is better. The workflow of the modality is better due to the artificial intelligence. We didn't stop over there. We continue by developing the artificial intelligence in order to have a workflow of AI. We know that stroke is number 2 reason of death in the world. So we create a workflow called automation platform stroke solution. When we do a CT, automatically the image will be sent to the automation platform solution, and we will have the ICH, LVO, perfusion, and aspect core automatically on the doctor's phone or on the web viewer of the hospital. So the workflow of artificial intelligence is right now between the hand of the referring physician, not only on the modality. We didn't stop on the stroke. We continue to have the chest pain artificial intelligence solution. So the EP and the AD, the aortic dissection, will be automatically processed after the CT scan. So this is who we are, the sponsor of artificial intelligence, or we consider ourselves the sponsor of artificial intelligence. Yep, thank you.
Can I ask you a question then?
Sure.
Well, thank you. I know I am aware that perhaps you were the pioneers. I would call you the pioneers as far as I recall. Yes, you are. And I guess my question goes, did you reduce the number of decisions that a radiographer, for example, or a radiologist would have to take? Are there like automated decision trees or decision things that will reduce the number of decisions that the radiographer would take? That's question number one. Because when you say that you reduce the time, I'm assuming that there is something behind it's not only the scanning time, especially for example for CT, scanning time is not an issue. And the other question would go, since you have your artificial intelligence incorporated with the machine, why does that sit you out as I mean, it's brilliant to have one solution that captures all, and I'm sure that this puts you in a different place compared to others. So I want you to please elaborate on that. And the last comment before I leave the floor for my colleagues is, that's a personal thing. I'm claustrophobic. So can you tell me what's the exact time for a lumbar spine scan MRI 3T Tesla? So those are your 3 questions. I'll stop here. I'll give you the time to answer, and then my colleagues will take it from there.
So regarding question number 1, what was question number 1? No. So decision making. We didn't reduce the decisions. We reduced the time for taking the decision. We always say we are as artificial intelligence providers, we are not replacing doctors, we are not replacing radiologists. We are helping them to make faster decision. So the decisions are the same number of decision, but less time. Instead of taking 2 hours of taking that, or half an hour to take that decision, you can take it in 5 minutes. The artificial intelligence help you to detect. Instead of a radiologist who's detecting clicking to have all the nodules. Let's say the artificial intelligence will check the nodule for him, and he will decide. He's the decision maker. He will decide those nodules are this and this and that. So instead of having 6-7 minutes or 30 minutes, he will have 5 minutes. We are reducing the time. No, we are not replacing the radiologist. Regarding number two, the difference, why I consider ourselves pioneer? Because our AI solution is embedded in the machine and it's our solution. It's from our home. It's not a third-party solution and I integrated with my machine. The market have plenty of AI third-party solution embedded in the machine. As Canon, we are doing this in our warehouse in Japan. So we are the owners of the solution. We embed it in the modality and we embed it in the workflow. So when, for example, when you have a CT scan, a full Canon CT scan made in Japan, having the automation platform, it's not integrated with another cloud solution from someone else. This is number two. Regarding number three, you are claustrophobic, we are help you in half time. So the lumber, usually how much it used to take for 30 to 40, depend on the sequences. Right now, it's half time, 50% of the time with the AI help. And same resolution. This is the no compromises, not even one compromise. Okay, thank you.
I'll leave the floor, but then I have to first, thank you, and I'll give you one bit that might also help you with coining the fact that you are pioneers. I think when you are the owner of both solutions, there's no blame game. Well, it's not the CT, it's it's the AI, or no, it's not the AI, it's the CT. So I think this cuts the chase. That's my interpretation. Thank you so much. I'll leave the floor to, you ready?
Thank you very
Dr.
much.
Ali.
Okay, thank you very much for the presentation. Actually, I love everything about AI. It is part of my interest. As we know that a lot of companies come with AI solution nowadays. Okay, and to be honest, it's a fragment. Some of them come with the chest only, some of them with the breast, some of them with only MRI. So in your case, are you doing everything like as a compact solution, or still the same, like only bits and pieces, solution? Thank you very much.
Thank you for your question. We made a plan and we have a timeline. So we begin our artificial intelligence within the CT because this is our point of strength. So we begin with the clinical automation platform on the chest pain and stroke solution. Then after that, we jump to the MRI. We have it inside the MRI. Regarding cath lab and ultrasound, we have it from a viewing imaging perspective. So because there is two kind of artificial intelligence, one for the images in the images, imaging, and the second one for workflow. From imaging, it's in all our machine, okay, all the series. From a clinical workflow, it's right now in the CT and MR, but the timeline is there. Okay, thank you for the questions.
Thank you so much for this nice presentation. May I ask you how your solution presented in AI with regard to the CT scan, has anything been done to reduce the contrast dose to the patient with regard to the contrast studies? Thank you.
We were working on reducing contrast and dose. We are the lowest company who reduces the dose, so our dose sometimes is 4 times less than other companies. Regarding the contrast, we know that the contrast was 1 cc per kg. Now it's 0.5 cc per kg because of the artificial intelligence. All those deep learning reconstruction images sent to our server in the test in the last 4 or 5 years help us to reduce the amount of contrast by almost 50%, I can say. Okay, thank you.
Thank you. Thank you for the very nice, very impressive introduction. My question is that if someone had to buy a machine with the same capabilities from another vendor without having inside the artificial intelligence, and to buy for the third vendor an artificial intelligence, say, program, had to pay more or less comparing with this price?
It's not nice question, and we have two answers for that. Regarding price, I will answer on that later. But you have another answer, which was answered by Mrs. Summer, that when you own all the solution, then you are not blaming any other. So you have the support, or you have the maintenance, the right maintenance, right support. Regarding price wise, of course, it will be better to have it from one company, because I can sacrifice, I can contribute. When you have a third party, you had to pay them. You can remove your markup, but at the end of the day, you had to pay them. And here, it's all your solution. I will not offer it for free, but I can offer it for free in order, if it is in order to promote my new city. So, from a money perspective, it's better to go that way. But much important from a technicality perspective, it's one solution with all. Yeah, thank you.
Yeah, I totally agree with you. So mainly regarding my question, which I asked, this is very, clear that there is a budget, cutting in contrast consumption. So if the consumption of contrast is by almost 50%, then also the procedure time, you mentioned that it's faster. So I'll take more flow of patients. So all these are, considerations in budget, constraints.
Our new machine with the new AI generation, right now we can arrive to 3 times more patients on your machine. So when you are doing a visibility study for a center with 20 patients per day, right now it can be 60 patients per day, even if it is a cardiac exam. Yep. Yeah. Thank you for your time.
Just wrap up with something, and I think it's very important. You've given us a lot of numbers that are very meaningful. What I do suggest is that you provide those numbers, please, to the recording team, so that they have that in the caption. So this is because it's very important and really indicates the need for A, you're reducing the costs, B, you're reducing the dose, and you're having more workflow. I mean, patient flow in the department. Like it's a, and of course it's a one-stop shop, one solution that has it all. I think this is brilliant. Thank you so much for your time. Thank you.